Since COVID-19 emerged in Canada, many governments across the country have made it easier for patients to video conference with their doctors. And so today I'm excited to talk to Dr. Brett Belchetz. He's the CEO and founder of Maple, which is a tool that allows patients to video conference with their doctors. So Dr. Belchetz, thanks for joining me today.
My pleasure. Thank you for having me.
So I'll start by just asking you to tell us a little bit about your story. Why did you decide to found Maple, and what are the types of services that you provide?
So my background prior to starting the company, I'm actually a physician, an emergency room physician based out of the Toronto area. And for many years, I was living and breathing all of the challenges that Canadians had with access to healthcare in this country. And so I was seeing patients day in and day out, sitting in a waiting room, waiting 6 to 8 hours to see me, often for visits that were 3 or 4 minutes in length for very simple needs, things like prescription renewals or an antibiotic for a urinary tract infection. And it kept occurring to me throughout many of these visits that it just wasn't necessary for patients to have such an unpleasant and disruptive experience when they needed to see a doctor, that there had to be a better way for patients to have access to healthcare. And the costs of those visits really were quite disturbing in terms of the cost to the patients, in terms of their health, in terms of their productivity, their lost income from work, and the cost to the healthcare system as a whole, recognizing that an emergency room visit was costing the system 10 times as much as a family doctor's visit would have cost if that was actually available to these patients. So the other side of the equation is there's just lots of excess capacity, and this is something that's just not known about. Lots of excess capacity amongst Canada's doctors. Only about 50% of Canadian doctors work fully or full time. So it led us to the realization that we could actually build a platform that would allow Canada's doctors coast to coast to contribute their capacity to help all of those patients that were in need. And so what Maple is it's that platform. We started the company in 2015, and Maple operates a national healthcare platform that allows Canadians on a 24/7 basis to get access to healthcare professionals when they need it. And it's done really, really well at getting quick access to healthcare. Our average wait time for Canadians to see a doctor on the platform in a moment of need is about 1.5 minutes, so almost instantaneous access to care. And over the 5 years that we've been operating, or actually almost 6 years we've been operating, we're up to almost 2 million patients now using the platform.
Well, that's it seems certainly really interesting. The changes that have happened over the past year, really, with more and more patients using these technologies. Of course, they were around before COVID, but starting to hear about more of the benefits. And it was something that I was kind of aware of. This tool was out there, but now it's attracted a lot more news attention. We actually did some public opinion research, and we asked the public about this option of video conferencing with your doctor, noting that in some provinces the change was made temporarily. And so we asked Canadians, do you think this tool should stick around after COVID is done? Should patients continue to have this opportunity if they like to video conference? And it was very, very popular. 87% of Canadians said yes. So you have mentioned a couple of the benefits. Obviously patients can reduce the amount of time that they spend waiting in an emergency room. It's cheaper for the system if a patient is speaking with, say, a family doctor than taking up emergency room resources. Could you tell us a few more of the benefits that you can see from not just a patient perspective, but even from a doctor perspective, even like from the perspective of the system?
Yeah, there's just so many benefits. So, I've spoken about some of the patient benefits. So clearly, as a patient, you are now able to access healthcare without the wait time. So you're not spending hours of your day unproductive. You are able to see healthcare professionals without travel, which, especially for rural Canadians, this is a huge benefit. There are many Canadians that live hundreds of kilometers away from the nearest healthcare professional. And certainly we know that the healthcare of rural Canadians suffers because the quality and quantity of specialist care that they have access to because of their rural location is quite limited. Virtual care levels the playing field. Even in terms of your own health, this is really important. So one of the things that always just threw me, really made me feel that we weren't doing a great job of how we managed access to healthcare is that I would see time and time again, I would see the 85-year-old patient sitting in our waiting room who was there just to get a prescription renewal for a high blood pressure medication, sit for 6 hours next to the person with the flu. And of course, then that 87-year-old gets the flu, and then that's terrible for them and terrible for our system, and obviously just an avoidable thing with virtual care altogether. There's a whole bunch of other benefits for patients just around comfort, especially around sensitive issues. We often see, even in the emergency room, there's a lack of privacy. There's many issues that patients just won't speak to us about and won't seek care for. That in a virtual environment, when they're in the comfort of their living room or their bedroom or their home office, they actually are comfortable to seek care for. So again, many conditions that we're just not getting their due care, like sexual health issues, mental health issues, et cetera, that we're now able to care for. From a provider perspective, there's a ton of benefits as well. So the ability to provide care without potentially having expensive physical office overhead. So as a physician in the old days before virtual care, the only way that I could see patients was to set up a whole office with a secretary and rent and equipment and a whole bunch of other things that were required. And now any physician who wants to sign up onto a platform can actually provide healthcare from anywhere they are. The other benefits is that we're really able to tap into, and this is what I mentioned earlier in our discussion, tap into huge pools of physician capacity that previously were unusable by physicians. So I'll give you a few of the examples, and we've seen this as part of our physician pool at Maple, and we've seen this quite effectively. So one, for instance, physicians who are on parental leave, so maternity leave, paternity leave, there are a massive percentage of Canadian physicians who at any given point in time have just had a child and as a result are unable to work in an office. But we have a very large percentage of physicians on Maple who have a child and are very effectively providing healthcare from home with that child in that home setting. So that would be one. There's a very significant percentage of Canadian physicians that are traveling, they're abroad, they're teaching, they're providing humanitarian care abroad, et cetera. And at any time prior to virtual care, they were not able to help Canadians back home, but now they can through the advent of virtual care. So no matter where a physician is in the world, they're still able to help. And then I'll give you another example, and this is a really powerful one for me as an emergency physician. If you look at the way emergency physicians like myself actually provide care, and emergency physicians are actually a very substantial proportion of family doctors are actually providing emergency care. Full-time for an emergency room doctor was considered to be about 15 or 16 shifts per month. And so for me, back in my old days of providing full-time work, I would do my 15 or 16 shifts per month, and then that was it. That was all the work that I could do. And I was typically very burned out as a result of doing 15 or 16 shifts in the emergency room. And even if somebody offered me the opportunity to pick up another shift, I probably would have said no because I was too burned out. But there were many times in those other 15 days a month that I have had off that I absolutely would have loved to treat other patients if you could give me the flexibility to jump on, see a few patients and jump off. Almost like that Uber driver like flexibility. And that's never existed in healthcare before. In healthcare, it was always, if you want to work more, pick up an 8-hour shift and otherwise don't work more at all. And so we now offer that kind of work flexibility to physicians, and especially on mail, where they want to see a patient or have lunch, see a few more patients, then have a coffee break. And that flexibility is wonderful for physicians, and it's amazing for the healthcare system as a whole.
I want to come back to that point in a minute, but I want to just back up to sort of how you actually go about video conferencing with a doctor. And from what I've read a lot of patient comments online from, you go into the Apple App Store and you can see what people think of the app for your company, other apps that are out there. And I've been surprised at how quickly someone can download the app, get connected with the doctor, chat with them, and maybe have their prescription sent off to a pharmacy. It seems like in some cases it could be as quick as like half an hour or something. Do you have any stats about how that timing works?
Yeah, so for us, it really is typically under 30 minutes end to end from the time somebody says, I need to see a doctor for a problem, and the time you actually have a prescription in hand. And the steps are you decide that you have a problem, you want to see a doctor. You may or may not have an account with us already, but I'll go through the process if you don't have an account. Typically, you would go to our website, you would click the link to create an account. Once you've created the account, which takes about 25 seconds, it's a very simple account registration process. You'll get a link to download the app. You'll download the app, which again takes another minute or two. Then you submit your problem, which is again a very streamlined process just for entering what your issue is. And then you submit your request out to the doctor pool. And as I said, the wait time is about a minute and a half from that point in time, and you will see the doctor within about a minute and a half. Average visits about 12 minutes in duration, sometimes faster, sometimes longer, depending on the complexity of your issue. And then after that, the prescription goes immediately to the pharmacy. And if you've got a pharmacy nearby, you can be at the pharmacy and picking up your prescription as early as 5 to 10 minutes. And in fact, we have programs with a number of pharmacies across the country where they actually set up patients to be able to see our doctors from the pharmacy site right there. So patients that will show up in the pharmacy and the pharmacist might do a rapid strep test, or might have something else that's going on, or there's a prescription renewal that's required that ordinarily would have required the patient leaving the pharmacy and going elsewhere to get that prescription. But in our world, what happens is they just download the app, do the visit right there by the pharmacist, potentially in a room that's available in the pharmacy, and then the prescription shows up right at that pharmacist's fax machine, and they get the prescription right away. So overall, it's an incredibly streamlined process that does not require much in the way of interruption of somebody's normal workday or somebody's normal at home or other chores that they have to do in their life day.
That seems really convenient, especially if you're a senior citizen and maybe you're not very savvy when it comes to new technology, and that you're a little concerned about, having to download an app and figure that out. To just go to your pharmacy and do the doctor consult right there, and then you just wait for your prescription to get filled, and then you're out. It certainly seems like it'd be a lot easier on senior citizens in particular, and those without smartphones or even maybe laptops, that type of thing. To jump now back to your previous point there about this enormous pool of doctors who are, often have flex time on their hands where they'd like to be helping patients, but they just haven't been, maybe provided with the right opportunities or whatever. But now they can pick up some, I don't want to use the term shifts, but some potential, appointments with patients who need that help. Does that help at all when it comes to doctor retention? Because in the past, Canada's had a problem where we train a bunch of doctors, and then inevitably a portion of those will just go to other countries because they want to earn more, or they want, some other types of opportunities that they're allowed to do that they can't really do in Canada. Have you ever looked at the retention angle?
I definitely think that that's an important angle. And particularly, I think where it's really important and where we're really seeing it make a difference is to go back to the example of rural communities. I think in those areas, it is tremendously helping the retention of rural physicians. One of the biggest elements, you spoke about financial remuneration, which I think is less of an issue now than it was in the past. But one of the biggest elements that is leading to us struggling to retain rural physicians, which is what you often see many, many communities without a doctor and struggling to hold on to their existing doctors, is the idea of burnout. Many rural physicians are the only physician in an area, meaning that they're perpetually on 24/7 call to their community. They can never take a day off. Every night they potentially get interrupted by issues that come in that they have to respond to. There is no ability for them to actually take care of their own health. And so we work in a lot of rural communities. We have programs where we actually virtually even staff hospitals in rural communities. And what we've noticed is that because we have this pool of national doctors across the country that are now helping in those communities, those rural physicians are having a tremendous weight taken off of their back. They're no longer having to be on call 24/7. They're no longer the only point of contact. If they take days off vacation, the digital healthcare community can step in and actually help to cover their practice for them for a few days. And this is actually making a huge difference. And we've actually heard firsthand from some of the communities that we work with that doctors are actually much happier and much more likely not to give up that job because they feel that they are now much more supported.
Well, that's an interesting benefit that I hadn't thought about. Obviously, we've chatted a lot about the benefits. There are, I would guess, many limitations of virtual medicine, especially if you need that physical interaction with your doctor. It's hard to get that through your cell phone. So I'll ask you to put your doctor's hat on rather than your CEO's hat. And could you tell us a bit about sort of maybe some of the limitations of virtual technology?
Yeah, you're absolutely right. And to be clear, when we started Maple, we never sought to replace all doctors' visits. There's just a lot of things that have to be done in person. And as a physician, I will any day double down or triple down on that fact. If you look at the medical research, typically it supports that you can do at least about 50% of doctors' visits virtually. And the things that can be done virtually are all of the things that either don't require me to physically touch you. So, it's a visual exam, it's a skin exam, it's a prescription renewal, it's something that I've already treated for you for before and I'm doing follow-up. It's all of those kinds of things. But then 50% of medical conditions absolutely do require some form of either hands-on examination or intervention. And so there's a bunch of things which we know you absolutely should be seeing your doctor in person for. So your annual health exam, some of it could be done virtually for sure, but not all of it. There are definitely physical examination maneuvers and exams that have to be done with somebody touching you. If you have to have a procedure done, 100%, we're just not anywhere close to being able to virtually do procedures. I think maybe sometime in the far future we will. But if you need stitches done, or, you've got a broken bone, or you need a biopsy done. None of these things can be done virtually. So 100%, there's a lot of those visits that are going to stay in the physical world. But I will say that what we're seeing is more and more things now are able to be done virtually. And the reason for that is that the technology that's in the home is getting more and more sophisticated. So the example I'll give you is, just one example is the Apple Watch. So more and more people have the latest Apple Watch, which now that not only gives you live tracking of your heart rate, it also gives you live tracking even of your blood oxygen levels. So when we look at something like that, you add on somebody who's got an Apple Watch, which is giving them their heart rate, their blood oxygen level. They often have a thermometer at home and a blood pressure cuff at home. Many people have those. You add all of those together, and now we're getting a full set of vitals that often is even better than what we'll get in many doctors' offices, because not every doctor's office even has the blood oxygen sensor. So now we can actually do a very comprehensive set of vitals checking, which would have been very difficult to do in the past. Add on to that the fact that they're very inexpensive scopes and devices that now allow us to digitally and remotely listen to patients' lungs, look in their ears, get a picture down their throat. And these devices have become less and less expensive over time. And one of my hopes is that eventually government will start to subsidize these kinds of devices for more use in the home, especially amongst vulnerable communities. You get to a point where if when I'm looking at a patient, I can get a full set of vitals, I can listen to their lungs, I can look in their ears and their throat and all of these other things, there's not a lot of examination now that I can't do virtually. And so again, we're not going to get to 100%, but we can get a lot closer to 100% than we are today, which I'd say is closer to about 50%.
Even 50% surprised me. That's a high number of opportunities for patients, especially when you think about all the convenience factors. One example that I love that I read about was I've seen this many times now, actually, moms and dads saying that it's a lot easier to just video conference with the doctor from, their own house rather than having to take their 2 or 3 kids, bundle them up, especially in the winter, lug them downtown to maybe if they have to go to see a specialist or wherever their family doctor is, pay for parking, all that kind of stuff, and potentially expose their flock of children to, other colds and viruses that might be in the waiting room and that. So I can see there's a lot of benefits that way. I want to ask you about the changes that occurred during COVID-19, but then also the potential for even more changes in cutting red tape to make it easier for patients to use some of these new technological tools. So my understanding is that when COVID-19 emerged, the change that occurred was that governments made it basically available for doctors to bill often at the same rate for a video conference appointment that they would what they could build a system for when a patient actually came into their office. Is that roughly correct? I know we got 10 provinces and they all have different rules, but is that generally speaking what happened in Canada?
Yeah, that's definitely correct. Prior to COVID-19, there was only one province in Canada that had any compensation for video consultations, and that was British Columbia. And in the rest of the country, if a patient wanted to see a doctor on video, the only option would be for them to pay for it privately. And so as a result of the pandemic and the realization that in-person care was probably not desirable, neither for the healthcare provider or the patient, most provinces very quickly stood up either temporary and some of them permanent billing code changes that allow doctors to bill exactly as you mentioned for these kinds of visits the same way they would bill the government for an in-person visit.
Okay, and thanks. And what do we need to see happen in your opinion going forward? Like what other opportunities are there for governments to cut red tape so that patients have access to more tools in the healthcare system? Maybe they're in the virtual world or something else.
Yeah, there's a few things that I think are really important. So one topic is national licensure, and we've seen a number of important bodies call for that. So the Canadian Medical Association has called for national physician licensure for telemedicine. So has the Federal Association of Medical Colleges. And by that, what I mean is that if I'm an Ontario physician, I'm based in Ontario, I can treat anybody anywhere in Canada by virtual care. I'm not limited to just helping Ontario. And that's really critical because when we look at our physicians across Canada, I think everybody would agree that an Ontario physician is just as good as a BC physician, is just as good as a Saskatchewan physician. We've got a very good uniform quality of healthcare providers and standards across the country. Mm-hmm. And that's a really important thing because some provinces have tons of doctors and lots of excess capacity and some do not. And so one of the saddest things that I've seen is that I, as an Ontario physician with all my excess capacity, I'm legally not allowed to help somebody in rural Saskatchewan who needs my help. I'm legally not allowed to help somebody in Northwest Territories who's desperate for care. So it would be absolutely transformational to have a national license that basically says any doctor anywhere in the country who wants to provide extra help can help any citizen anywhere in the country. I think that would be beneficial for doctors, beneficial for patients. And I think there's very few that would argue that, but I think bureaucracy so far has prevented that.
Hmm.
The other things that I think have to go with that is cross-provincial billing. So one of the other issues is if I'm an Ontario doctor and I treat a patient who's located in Saskatchewan,
Mhm.
who pays me for that? Right now, no province will pay me. Saskatchewan wouldn't pay me and neither would Ontario. So we need to figure out mechanisms that would allow for some form of billing and remuneration, because otherwise it becomes very difficult for patients.
Hmm.
The final thing I'll comment on is when we look at what's been covered to date, so far, the only form of communication that's widely covered is video. Some provinces are covering telephone calls as well.
Mhm.
What we've experienced at Maple is that the vast majority of healthcare encounters don't require video or even a call. The vast majority of encounters can actually be solved just through secure messaging. And not only that, about 70% of patients prefer to see their doctor, if possible, through a quick secure messaging chat versus having to do a video call.
Mhm.
And a lot of that is related just to the circumstances they find themselves in. Either they're at work and they can't do a video chat in front of people at work. They're taking care of children and it's very difficult to do a productive video chat while a kid is screaming next to them. And so being able to securely message while doing that is very easy. And there's a whole number of reasons just even related to privacy. A lot of patients just feel much more comfortable talking about potentially difficult issues by secure messaging. And then the final thing I'll say is just we have a society that's very used to doing everything by messaging versus having to do video chats. If you look at the stats around how many people are sending iMessages every day versus doing FaceTime video chats, it's clear people like messaging much more. But right now, there's no remuneration anywhere in the country for people to do chats by messaging. And so I think we do need to start to think about how do we allow patients to have access to their doctors by mechanisms like messaging without having to pay for that out of pocket.
That's really interesting. You've given us some interesting ideas for potential red tape options that could be cut in the future. So if we have time, we'd love to take a look at some of those further. Just on that last point about messaging, is the idea that maybe someone notices perhaps a mole on their body and they're wondering, hey, is this something I should be concerned about? So they could just snap a photo, text a doctor, a medical professional, and just get an opinion that way. That kind of
Yeah,
thing.
exactly. And exactly. And a lot of the time the care is actually, if you can believe it, better when we do it that way than when we do it by video. And mostly just when you think about the resolution that your camera on your phone has
Mhm.
versus the resolution we have in live video. So you get monumentally better image quality when somebody takes a photo of their molar, takes a photo of the back of their throat versus we try to see it on video.
Yeah.
And also it creates a better medical record. So if you photograph that molar, you photograph the back of that throat, that becomes part of your medical record, meaning when you do the next visit 6 months later or a year later, the next doctor can compare the images over time. So, not only is messaging something that's, you're actually getting really quality of care. The final thing I'll actually mention as well is that it really does help to augment the coverage from the physician side for patient needs. So there's lots of doctors who, for instance, at 1 a.m, because they're in their pajamas, would be happy to speak to a patient by secure messaging, but they don't want to do a video chat when they're in their pajamas in the middle of the night. And so what we find is especially, and the patients as well don't really want to do video at 1 a.m. So for 24/7 and after hours coverage, we're going to get much better physician coverage by allowing things like secure messaging to help to meet patient needs.
Oh, that's fascinating. I've seen a few articles and videos on future technology and even some of the technology we have right now and how that could be unleashed in the healthcare system to give patients more choices, more options, and also better outcomes, most importantly. I just want to follow up with one final question. Is there anything that we've missed that you'd like to add?
No, I think you've asked all the right questions. And I think, really the most important thing to know is that I think virtual care is clearly here to stay. And I think we're going to see more and more benefits over time from it. I think what you're seeing is just the tip of the iceberg of adoption. I think we've seen huge adoption during the pandemic.
Mhm.
And I'm really excited to see how this is going to benefit our society as a whole, even as we come out of the pandemic in terms of better access to care and being able to provide care more efficiently.
I think you're right. I think it's certainly a positive development, and like I said, our polling shows the public likes it. So I think that's exciting for what the potential could be in the future for more of these opportunities. Just finally, if someone wants to learn more about your company, what's your website and how do they get your app?
Yeah, best thing to do is come to our website. It's getmaple.ca, getmaple.ca. You can find us on the App Store, on iOS, just search for Maple. We're the top rated app named Maple. Same on the Android store. You'll find us under Maple as well. Very easy to find us, and we're always happy to answer questions. We've got a really responsive support team that's on all day, every day.
Well, that's great. And like I said, I went through the comment section on the App Store, and there were a lot of very overwhelmingly positive comments. So there's some really interesting anecdotes in there. So again, thank you very much for giving us a quick 101 on virtual healthcare, what the changes have been, what the opportunities are. I really appreciate it.
My pleasure. Thank you so much for having me, and stay well.
Take care.